Good morning, friends. Today we are going to discuss about drug administration. అందరికీ నమస్కారం అండి. మనం ఈరోజు డ్రగ్ అడ్మినిస్ట్రేషన్ గురించి తెలుసుకుందాము. అకార్డింగ్ టు WHO, రైట్స్ ఆఫ్ డ్రగ్ అడ్మినిస్ట్రేషన్, 6 rights of drug administration is there. According to them, before giving medication, drug to the patient, we have to follow 6 rights. Right patient, right medication, right dose, right route, రైట్ టైం అండ్ రైట్ డాక్యుమెంటేషన్. మనం మెడికేషన్ ఇవ్వబోయే ముందు ఖచ్చితంగా ఈ 6 రైట్స్ని మనం చెక్ చేసి మెడికేషన్ అనేది ఇవ్వాలి. రైట్ పేషెంట్, ఫస్ట్ మనం రైట్ పేషెంట్ చూసుకోవాలి. రైట్ మెడికేషన్, డాక్టర్ ప్రిస్క్రైబ్ చేసిన మెడికేషన్ మనం తీసుకున్నది రైటా కాదని చూసుకోవాలి. రైట్ డోస్, రైట్ రూట్ అండ్ రైట్ టైం, రైట్ డాక్యుమెంటేషన్. దీస్ ఆర్ ఆల్ rights of drug administration. Next we will see routes of drug administration. We are having 2 types of drug administration. One parenteral, second one enteral. Parenteral means through syringe. మనం syringe ద్వారా ఇచ్చే మెడికేషన్ని parenteral. Other than enteral is called parenteral. So in that we are having so many kinds of drug administration. First one IM, second one IV, third intradermal, fourth subcutaneous, intravascular, intracardiac. These are all parenteral routes of drug administration. Next we will see enteral routes of drug administration. Enteral means oral routes of drug administration. We will see clearly about IV route. IV రూట్ని బోలస్ రూట్ అని కూడా అంటారు. IV మీన్స్ ఇంట్రావీనస్ రూట్. ఏ మెథడ్ ఆఫ్ డ్రగ్ అడ్మినిస్ట్రేషన్ డైరెక్ట్లీ ఇన్ టు ద వెయిన్ యూజింగ్ సిరంజ్ ఈజ్ కాల్డ్ IV రూట్. సో బోలస్ మీన్స్ వాట్? అన్ ఇంట్రావీనస్ ఇంజెక్షన్ ఆఫ్ ఏ సిరంజ్, ఏ సింగిల్ డోస్ ఆఫ్ ఏ డ్రగ్ ఓవర్ ఏ షార్ట్ టైమ్ పీరియడ్ ఆఫ్ టైం. సో బోలస్ అంటే ఎమర్జెన్సీ కేసులో బ్లడ్ లాస్ అయినప్పుడు డాక్టర్స్ ప్రిస్క్రైబ్ చేశారు 1 NS within 10 minutes, 1 NS within 15 minutes, like that. That is short period of time we have to give medication, a single dose in short period of time. Actually that should not be given, but in hypovolemic shock, those cases we will give bolus route. That's why IV route is also called bolus route. Here we will use needle 1/2 inch to 2 inch needle, and gauge of needle is according to patient will use gauge of needle. Angle of needle, so here we will use angle between the IV and syringe is 25 to 30 degrees. Next we will see sites of IV routes. First main site is medial cubital vein, prior site of vein puncture. This is so in children's, in neonates we will use scalp vein, and radial vein most commonly IV site for IV canalization we will do radial vein. Umbilical vein, most common vein in blood transfusion in neonate is umbilical vein. So umbilical vein we will use in neonate blood transfusion. Cephalic vein also will use, basalic vein, dorsal metacarpal vein, dorsal plexus. All these veins we will use in for putting canalization. Next we will see, so drug effect. If we'll give IV injections, the effect of drug will be within 2 to 5 minutes. So next we will discuss about the complications. So while giving IV route injections, the patient may get pain, infection, bleeding, phlebitis. Inflammation of walls of the vein is called phlebitis, and air embolism, gas embolism, entering of 1 or more air bubbles in a artery or vein is called air embolism or gas embolism. Next, infiltration. So diffusion or accumulation of foreign substance is called infiltration. Infiltration, also called extravasation, means seepage of IV fluid out of a vein into surroundings of the tissues. So here, seepage of fluid out of a vein into the surrounding tissues. ఒకవేళ ఐవి క్యాన్లా కానీ మిస్ప్లేస్ అయినట్లయితే మనం అడ్మినిస్ట్రేషన్ చేసే డ్రగ్ అనేది సరౌండింగ్ టిష్యూస్లోకి వెళ్తుందన్నమాట, డిఫ్యూజ్ అవుతుందన్నమాట. దాన్ని ఇన్ఫిల్ట్రేషన్ అని అంటారు. ఫ్లెబైటిస్ అంటే ఇన్ఫెక్షన్ ఆఫ్ ది వాల్స్ ఆఫ్ ది వెయిన్ ఈస్ కాల్డ్ ఫ్లెబైటిస్. సైజ్ ఆఫ్ క్యానులా. సో we mostly used so many kinds of cannulas, in that according to patient, according to person, we will put cannulization. Okay, we are having 14 gauge cannula, 16 gauge cannula, 17, 18. So 14 gauge cannula is in orange color, 16 gauge is ash, 17 gauge is white in color, 18 gauge is green, 20 gauge is pink, 22 gauge is blue, 24 is yellow, 26 is violet. Most commonly in adult we will use 20 gauge cannula, pink cannula. Most common cannula size in children is, children we will use 24 gauge yellow cannula. And for blood transfusion we will use 16 to 18 gauge cannula. For bolus dose of medication also we will use 16 to 17 gauge cannula. For these most bolus doses will give hypovolemic shock patients. Next we will move on to the intramuscular. Intramuscular injection. Here needle size will be 1 to 1.5 inch. Gauge of needle is 22. Most commonly we will use 22 gauge needle. And angle of needle is 90 degrees. And quantity of drug, here we need to give up to 5 ml only drug. More than that we should not give IM route. Next we will see what is the common sites of IM administration of drug. Deltoid muscle. So deltoid muscle we will give injection TT 0.5 ml we will give. Ventrolateral, most common IM injection site for children's. This is lateral aspect of the thigh we will give this injection. Amount of drug here ventrolateral route is 1 to 2 ml. Gluteal muscles also will give. Actually we will give gluteus minimus muscle only we will give the injection. Most deep IM injections we will use ventrogluteal. Deep IM injections will be given ventrogluteal only. Some drugs causes the burning sensation. So magnesium, sulfate, iron and haloperidol injections will cause burning sensation if it will flow back to the muscle. So those kind of cases we will give jet track method IM injections. What is jet track method? So here see the needle will go and with our fingers we have to press down, then we have to give injection. Then after taking out of needle we have to release this one. There is a formation of jet track here. So it will seal the medication. It will seal the medication. It will prevent the backflow of medication of drug. So nice absorption also will be there. Proper absorption also will be there. And then there is no irritation to the patient through this irritational drugs. Next we will move on to the intradermal injection. Here we will use syringe, tuberculin syringe. So length of syringe is length of needle is 3/8 to 5/8. Gauge of needle is 26 gauge we will use. Quantity will be, through this syringe we will give 1 ml. This is 1 ml injection. Only 1 ml we can administer. Angle is 15 degrees only we will give. Sides. Anterior aspects of inner side of the forearm. Posterior aspect of the upper arm. Drug effect. Within 5 minutes, the drug effect will be known. Test dose, any dose, we will give any other dose like antibiotic test dose, iron test dose, and haloperidol test dose. Test dose will be given in these routes because we can know the side effect of the drug within 5 minutes. Next, we'll move on to the subcutaneous route. Subcutaneous route. Here we will use syringe, insulin syringe. The length of syringe needle is 5 by 8. Gauge of syringe is 25 gauge and the angle of syringe will be 45 to 90 degrees. Quantity we will give here 1 to 2 ml. Sites. Most common site is abdomen, upper aspects of the here see. Abdomen we will give and sides of the upper arm means outer aspects of the upper arm and anterior aspects of the front thigh. And also we will give anterior posterior aspect of the chest and scapula also we will give. Next routes are enteral route or oral route. So most common route for drug administration is enteral route, nothing but oral route. So here disadvantages are slow absorption, large dose needed for desired effect. Here for desired effect they will give large dose. Contraindications. Unconscious patient we should not give oral route, and small children oral surgeries. Dysphagia means difficulty in swallowing. Those kind of patients we should not give oral route. Drug effect 30 to 60 minutes it will take place. Next, the sublingual means under the tongue, below the tongue. Example NTG, nitrotriglycerides. Next, buccal means between cheeks and gums. These are all gums. This is cheek. Between cheeks and gums, we will give drug administration. It is called buccal. Example, nicotine gum. Other routes also is there. We will discuss about that also. Insertion. Administration of solid form of drug into body cavity or orifice is called insertion. Example, suppository, vaginal suppository or rectal. Next, instillation. Administration of liquid form of drug into body cavity is called instillation. Eye drop instillation, ear drop instillation, like that. Next, insufflation means administration of powder form of drug into body cavity. Example, blowing of oxygen into trachea. That is called insufflation of trachea. So, for making pneumoperitoneum during laparoscopy, so we will use carbon dioxide. So, those kind of insufflation is called abdominal insufflation. Next, implantation. Administration of solid form of drug into the body tissues. That is called implantation. Next, injection. Simple application of drug by rubbing. Example, diclofenac gel. If we are having any muscle pain, then we will apply diclofenac gel by rubbing. That process is called, that route of drug administration is called injection. Next, inhalation. Volatile form of drug inhaled. means through inhalation. This is also fast acting route of drug administration. Some of abbreviations are SOS means if necessary, PRN means when required, HS means at bedtime. Thank you for listening. This is our small topic about routes of drug administration. If it is useful for you people, please share, subscribe and like. Thank you.